You're listening to Civic from the San Francisco Public Press. Laguna Honda Hospital administrators are overhauling policies and procedures to regain the federal funding they lost after some damning inspection reports. But to get the money, they have to transfer out nearly 700 patients with complex needs. And that is wreaking havoc.
She is going to be one of those people that is going to be greatly stressed by this move. It's traumatic. She has dementia. She is very lucky that she's been there as long as she has been, and I would hate to have to say goodbye to her because of this.
Residents do very poorly, typically as a result of these kinds of mass transfers, and this is a very highly vulnerable population.
I'm Sylvie Sturm, and this is Civic. The April 14th announcement that the Center for Medicare and Medicaid Services, or CMS, would cut funding to Laguna Honda created a mad dash among hospital administrators to fix problems. Meanwhile, part of the process to regain funding requires them to transfer out nearly 700 patients with complex needs. Either task alone would be daunting, but combined, they're proving to be nearly impossible. The state inspections that led to the decertification were triggered by 2 non-fatal overdoses last July. They revealed problems of altercations among patients and drug use. In our last episode, we talked to former Laguna Honda Hospital physicians who said they warned the city of the potential for those very problems 18 years ago.
This is Dr. Teresa Palmer. I'm a MD geriatrician, and I worked at Laguna Honda for 15 years until 2004. This shutdown was predictable. Normally, a nursing home is filled with primarily women over 85, and now you have a nursing home with predominantly men from 40 to 60. The city needs to provide funding and a place for people with substance use problems and conduct disorders.
At a June 14th San Francisco Board of Supervisors public hearing, Supervisor Asha Safai asked about challenges related to the changing population. He spoke with the head of the San Francisco Health Network, Roland Pickens. Pickens became interim CEO at Laguna Honda on June 2nd, when former CEO Michael Phillips left without explanation.
Would you say that some of the issues that have arisen at Laguna Honda have been because of the mixing of different age groups and populations?
I would say that particularly some of the issues related to illicit substance use, like the overdoses that occurred last summer, are related to having that particular population, because that's a part of their lifestyle. And, one of the things about Laguna is historically it's served all of San Francisco, and particularly, I think, with the destigmatization of mental health and substance use over the last few decades, we've then also seen that transfer to then the patient population that Laguna takes care of. And so thus the increase in behavioral health and younger clients.
Is part of your recertification or part of your reorganization and management of the facility, is there a plan to deal with the difference in age and difference in need of service delivery? And we talked a little bit about that. I just wanted you to share that on the record.
Sure. You must have been in some of those rooms where we've been with the consultants, because in fact, that's part of the feedback that they're giving us, is that as they've come in and made these observations about Laguna, one of their recommendations is that we considered what's very common in healthcare, which is cohorting patients with similar issues into areas where they can really get the specialized, detailed care that they need. So it may very well be that as we emerge from this recertification process, when we actually sit for recertification, that we'll establish, say, a behavioral health unit or a unit that may cohort particular patients who right now may be dispersed among the 13 units, but may then be cohorted into 1 or 2 units that can better take care of their needs.
Would you then, by the nature of that, would then put the more senior population amongst themselves and the younger population amongst themselves?
That very well could happen. When you visit Laguna, we basically have 2 towers in terms of where the nursing units are located. So it sets itself up for being able to have one set of programming in one tower and another set of programming in another tower. So at this point, the options are many for us in terms of how do we best structure the facility going forward to minimize particularly any regulatory noncompliance as it relates to substance use and behavioral disorders.
Former Laguna Honda physician Dr. Derek Kerr was leery of this solution. We introduced Dr. Kerr in our last episode. He worked at Laguna Honda from 1990 to 2010. He's now an investigative reporter and acts as a watchdog over the hospital.
Theoretically, yes. If there's a sequestered environment for these unstable, behaviorally disruptive patients at Laguna Honda that's separate from, the older population, that makes sense as long as you have the resources and the expertise to care for them. We have not had that. A tower or a separate unit is one option. The other option is a program separate from Laguna. Keep Laguna Honda for the elderly and the physically disabled and have a separate facility for this increasing population of patients with mental and substance abuse disorders.
He acknowledged that this is a tall order.
It's very hard to get state and federal funding for long-term psychiatric care. And that was one of the problems that San Francisco General had. Their psychiatry ward was full. They had no place to put the patients after 30 days. Payment was exhausted. So they wanted to send them to Laguna Honda. The city did set up some years ago a mental health rehabilitation facility. There was a $26 million bond measure to set up this facility, but it collapsed because it couldn't get funding to provide services.
During the June 14th hearing, Supervisor Myrna Melgar, who represents Laguna Honda's city district, pushed back on the notion that a certain segment of the population should not be admitted to the hospital.
Of course it serves a different population, because 50 years ago was 50 years ago. And Laguna Honda is a gem of an institution that serves San Francisco as it is today. So to me, we will get better. We will get recertified. We will come up with new protocols and do training of staff and do all the things that we need to do to be in compliance. But the cure is not to serve a different population or serve a population that we served 50 years ago. It is to come up with systems that deal with the population that we have today. That is who we are. That is our values as San Francisco. That's who we need to be. And we need to do more of it, actually, not less.
Before Laguna Honda can gain CMS recertification, it has to pass several inspections. Consulting firms Health Management Associates and the Health Services Advisory Group are in the process of orchestrating mock inspections that simulate those conducted by regulators. The first one happened in June, and Laguna Honda is in the process of correcting deficiencies. Some steps already in the works are the addition of San Francisco General Hospital quality management staffers, more nurses, more sheriff's patrols, smoker patrols, safety searches, and visitor screenings. There will also be handheld narcotics analyzers to scan patients for drug possession when they return from leaving the facility. Dr. Kerr believes that these solutions are not conducive to a healthy environment for a large portion of the patient population.
When you have behaviorally unmanageable patients in an institution, you have to fortify the institution. So you've got drug scans at the doorway. Every patient, every visitor coming in gets photographed. The drug sniffing dogs, increased police presence, clinical searches. The nurses are searching the patients for contraband. So those kinds of constraints are diametrically opposed to what nursing home care should be for elderly patients. They need a completely different model. So the risk is that you transform the hospital into a carceral complex in order to manage an antisocial subset. So that's the problem. It might deform the hospital.
A second mock inspection will happen in August. By September, Laguna Honda should be ready to apply for recertification. Then, CMS inspectors will conduct an initial survey. If Laguna Honda passes, CMS will return 90 to 120 days later for a final inspection. That hiatus provides a reasonable assurance period that the fixes are permanent. If all goes well, Laguna Honda will be in the clear by 2023. But while administrators work to correct violations and apply for recertification, they also have to transfer all patients out of the facility. The city's health department created an online dashboard to show the progress of patient transfers. It shows that staff are making about 1,500 calls a week searching for open beds. And as of this week, 16 patients have been transferred to skilled nursing facilities and 9 were discharged, 3 of them to homeless shelters. Dr. Kerr said trying to transfer this patient population is extremely problematic.
The problem now is that the types of patients at Laguna Honda who are largely on Medi-Cal, and many of whom have behavioral and complex medical needs, are not good candidates for private nursing homes. They can't be placed elsewhere. The reason they're at Laguna Honda is sort of a last resort sanctuary.
Laguna Honda accounts for 34% of all skilled nursing facility beds available in the city, and finding other suitable beds has proven to be a Herculean task. CEO Roland Pickens gave a slideshow presentation explaining the challenges during the Board of Supervisors hearing on June 14th.
When calling the facilities in San Francisco, we're finding that they have an average of 3 to 5 open beds at any one time, and in 1 week they had no open beds. Then when you look at the rest of the state of California, the bottom rows, you'll see that throughout those 2,000 skilled nursing facilities in California, you'll see about 1,400 to 1,500 beds available during any given week. However, it's important to note the vast majority of the patients at Laguna Honda have Medi-Cal, the Medicaid program, or Medicare as their insurance coverage. When you look above the rows that say how many of those beds available are Medicare or Medi-Cal, you'll see 0 in terms of the beds in San Francisco, and you'll see single to low double digits across the state. And that's because for many skilled nursing facility providers, they limit the number of beds that they have by financial class. And so there are very few beds available for patients with Medi-Cal and Medicare. And thus our dilemma. We have a responsibility by virtue of the closure plan that CMS approved that we must make every effort and we must begin to transfer and refer patients to other facilities. And CMS has made it very clear that our funding is contingent upon our ability to make this. They are also, and they should be very clear about the dearth of beds that are available because we provide this same data to CMS every week so they can see what we're finding as we try to find available beds. So the timeline in the closure plan approved by CMS is September 15th. The chances that we're actually going to move all of them, we're going to do everything we can. We're going to look for every bed that we can, but the numbers state that we're probably not going to meet that goal, but we're going to do everything we can. And I can tell you that CMS has not told us to shut Laguna Honda down. What they have said is Laguna did not meet their requirements, became decertified, and if you want to come back into the program, go through the process that any other skilled nursing facility would do, and that's the certification process. What complicates it is that they also then have this closure plan that they've tied the money to.
Several city lawmakers expressed bafflement at the mandate. Here's Board of Supervisors President Shaman Walton.
So explain to me, telling you to come up with a closure plan, explain to me how that's not asking you to relocate everybody to other facilities and shut down the hospital. That's hard for me to understand. Unless I'm crazy, I don't get that.
No, you're not crazy. And as I said, it's incongruent, it's antithetical, because they're two opposing things. However, that's the dilemma we're in, and that's where we are with CMS.
And here's Supervisor Rafael Mandelman.
I mean, this is some Kafkaesque nonsense. The state and the federal government are coming after San Francisco, which is providing 700 beds to care for people that the state and federal government have abandoned. This is mind-boggling.
And Supervisor Dean Preston.
The idea that the path to continuing to provide these critical services for the most vulnerable people is to kick them all out so that we can bring them all back is absolutely bonkers.
Dr. Charlene Harrington, a professor emerita at the University of California, San Francisco, explained that the lack of facility beds comes down to an ever-present vexing problem.
Because the real estate is so expensive. Most nursing homes are private, they're for-profit, and they're trying to make money on their real estate. And so it's too expensive to build new facilities in San Francisco. And so that's why the city, a lot of the beds have been just limited to post-acute beds, and they don't want to take Medi-Cal patients because they consider the reimbursement rates too low. So they look for residents that are easy to take care of, that are not going to cost them a lot of money so they can make more money on them. And also residents where they don't have to have a lot of staff.
Dr. Harrington says the solution comes down to affordable housing.
One of the things that forces individuals with disabilities and care needs into an institutional setting is if they don't have adequate housing. So if San Francisco can address its housing problem in a better way, then it would maybe not have to have so many people at Laguna Honda, because a number of the individuals there could probably live in residential care or in other housing arrangements if they had the proper supports. So the city really needs to put the greatest emphasis on getting their low-income and disability housing set up.
Given the obvious challenges, Dr. Harrington said she's confounded by the mandate to transfer out all patients.
I was quite surprised because Laguna Honda is generally considered to be one of the better facilities and it has very good staffing. It's had fairly good ratings. It's had some incidents and some problems, but I was surprised when the state moved to take that action because it seemed sort of severe. As I saw it, they had something like 24 deficiencies on one of the last surveys, but they didn't seem to be that serious. And, a typical facility is only 100 beds. A typical facility could have 10, 15, 20 deficiencies. And so for Laguna Honda to have 24 for 700 patients is not that out of line. I'm not saying those deficiencies don't need to be fixed, but I'm just trying to put it in perspective.
She also questioned whether it's even legal.
I don't understand why they're asking them to transfer anyone out because the facility has their license, and that makes no sense at all. And I think that's a misunderstanding. You could talk to the California Advocates for Nursing Home Reform, but they're not really allowed to move people out. And so if they're doing that, that seems to be improper. As long as they're licensed, they have to have a plan to move them out if they should close. But at this time, they should not be moving anybody out.
She theorized that the federal government may be trying to make an example of Laguna Honda.
The Centers for Medicare and Medicaid also had a very poor enforcement record. And I think the Biden administration is really trying to turn that around and to improve the enforcement. And so I'm sort of assuming that the state has been under pressure to do a better job. And so for some reason, Laguna Honda was one of the facilities they decided to take action against.
Laguna Honda patients have the right to appeal their discharges with the state. Tony Chicotel, a staff attorney with the California Advocates for Nursing Home Reform, said his organization has been concerned with the legality of Laguna Honda discharges for a while now.
The concern is that the public guardian's office might be willing to agree to discharges that are not really in their residents' best interests because it's in the city and county's best interests. Another element of this, we've been getting more and more reports of Laguna Honda sending residents to homeless shelters. I think that's been a problem for a long time. And one of the threats they're using, and have in fact used in one of our cases, is to call the police and have the police basically enforce a discharge without having to go to court. So residents of nursing homes have all the same rights as other folks to not be evicted from their homes without due process. But Laguna Honda seems to be cutting through, or at least in some cases are cutting through, in other cases threatening to cut through the due process simply by calling the police, who happen to be employees of the city and the county. We're a little concerned about the incestuous relationship of key agencies to Laguna Honda and having these agencies do the bidding of Laguna Honda in a way that deprives residents of their due process and legal protections.
He was also baffled by the CMS mandate to force all patients out of the facility.
I don't want to sound like enforcement is misplaced here, but in this one particular case, in this context of Laguna Honda, it does seem like it's overkill. We think enforcement is needed to improve quality of care, but enforcement that leads to closures of facilities that don't have the same sort of systemic horribles that other facilities have, it's odd. I think that part of this might be an effort to increase severe enforcement actions from CMS, because we've seen more decertifications in this past year than we've ever seen before. So there's definitely been an uptick, and improved scrutiny from CMS is welcome. But just in this one case of Laguna Honda, we're puzzled as to why. And not only because the facility doesn't have the same horrific track record as other facilities that aren't being decertified, but because of the volume of the residents, the number of residents is just huge. I mean, Laguna Honda is the largest nursing home in the country, I believe. It's at least the largest nursing home in the country west of the Mississippi, but I think it might be the largest nursing home in the entire country. So I don't know if CMS thinks that this is the right kind of facility to make an example of, but I would suggest it ought to be a different place. So much about this Laguna Honda story is unusual. The decertification, it doesn't seem to be entirely justified, doesn't seem to be justified at all, really, is one part of it. And then the second part of it is the formula for getting recertification, which in a nutshell seems to be clean house. And cleaning house means taking out the garbage, which in this case, and I hate to use the term garbage, but that's the way these residents are being treated, is get rid of all the residents and then start over again. And it's odd that part of the recertification process is giving the facility a thorough survey and ensuring that their current care standards are up to snuff when there's no residents to take care of. So how would they prove that the care in the facility is going to be great when there's no residents to take care of? There's a lot of inconsistencies here, a lot of concerning inconsistencies that makes us wonder about whether we're getting the entire story or not.
Even if administrators find an open bed, destabilizing fragile patients and sending them far away from loved ones could have grave repercussions.
Our major concern is the fate of those residents, that they will go to other facilities. Some of them certainly will be lower quality facilities. Some of the bottom feeders in terms of the California nursing home marketplace. We also have significant concerns that residents will be sent out of state, hundreds of miles away from their support networks, from their homes. And we know, based on prior studies and also our own experience with nursing home closures, that residents do generally very poorly when they're transferred, because they're all sent to new facilities where the staff don't know them. They have to learn how to provide good care to these particular residents, and a lot of residents suffer in the meantime. There's a concern known as transfer trauma, where the healthcare outcomes of residents who are transferred generally are very low, and some of them suffer death as a result of the learning curves of the new facilities. And then there's also the concern that they're disconnected from their support systems, which are often very important to resident healthcare outcomes, visitors from friends and family, advocacy from friends and families for better care. Just their presence in the essential care that they sometimes provide is lost. So residents do very poorly, typically as a result of these kinds of mass transfers. And this is a very highly vulnerable population. We've got several hundred folks. I suspect that many of them will suffer harm, significant harm, as a result of this closure.
The director of the San Francisco Long-Term Care Ombudsman Program, Ben Nadel, explained the dilemma during the June 14th public hearing.
We have worked with closures that were voluntary in the city for quite some time, the last being St. Luke's, which closed. 2 supervisors weighed in and prevailed, and 17 subacute patients were relocated to Davies campus. 2 years later, 8 are still living. And that's a testimony to unseen forces resulting from a relocation. We worked with Mission Bay, a small place on Pennsylvania Avenue, monolingual Cantonese. That was a voluntary closure. 32 people were moved to East Bay and Burlingame. Other places, families could not visit every day like they did. That's a cultural issue. I heard from a nurse director 3 or 4 years later that only 2 residents are still alive. That's a testimony to some of the adverse effects of relocation. Laguna Honda is special. The Ombudsman program are working intimately with some of the management and quality people at Laguna Honda. I have to say it's the best in the city. Family members are calling us up. Residents are now calling us up. The Ombudsman are the avenue for all the emotionality and the anguish families are experiencing when they're notified that their person is slated for relocation.
Anguished relatives also called in to the June 14th public hearing, saying they're afraid for their loved ones' lives.
My name is Alana Greenham, and my mother has resided at Laguna Honda Hospital for 8 years now. She is 96. We had her in the community. We had her in, not board and care, but like assisted living. We moved her to a community care facility, and now she's at Laguna Honda, and she's a native of San Francisco. She was born here. She was schooled here. She went to college here. She taught here, and she's a lover of art, and we can't even tell her yet that she has to leave because we don't know if she can leave. And she is going to be one of those people that is going to be greatly stressed by this move. It's traumatic. She has dementia. She is very lucky that she's been there as long as she has been, and I would hate to have to say goodbye to her because of this.
I'm Sylvie Sturm, and you've been listening to Civic. Civic is produced by KSFP-LP, a project of the San Francisco Public Press. Our team includes producer Leanna Wilcox and contributor Mel Baker, who's also program director for KSFP. Lila LaHood is the publisher of the Public Press. Michael Stoll is our executive director. Lisa Rudman is our development director. John Dillon created our theme music. Thanks for listening.